Welcome back to my channel on chronic illness, Lyme, and mold. I'm your host, Dr. Diane, and we're talking about post-treatment Lyme disease syndrome. Many people find their way to this particular disease process, this particular diagnosis online. And one of the things that I want everybody to understand here is that this is something that can happen whether or not you know you have had Lyme disease. So sometimes for people, they get into a situation where they have all of these disease processes that are these symptoms that are emerging, and they had Lyme testing and treatment years ago. Other times people never knew they had Lyme, but they have a similar symptom picture. So in this video, I'm going to talk a little bit about why this happens, how to identify this in you, as well as steps to take to get results, as well as a free quiz to help you know if you likely have this or not. Okay, so let's start with some of the facts and some of the myths and break down some of the things that we see. So when we have post-Lyme treatment syndrome, one of the reasons we have this is because the common ways that we are treating Lyme, such as doxycycline. Doxycycline will clear the blood really, really well of Lyme. However, it will also have the Lyme bacteria, Borrelia burgdorferi, switch and morph into its more dormant form. What this means for many people when they are treated is that they get initial treatment results, of course, not all the time, but much of the time. And when this happens, this can then lead into essentially getting a situation where they feel better. And then years down the road, because the Lyme has gone into that dormant form, it will come out of hiding and it'll manifest symptoms. Now, symptoms in this particular situation are going to be oftentimes much different than the original symptoms. Symptoms originally for many people are skin changes, are flu-like symptoms, sometimes joint pain, right? But when it shows up later, after re-emerging from its dormant state, which is essentially what's happening, because when we have Lyme go dormant, it can actually re-emerge into its active form. It's usually stress that will trigger this, but exposure to certain toxins such as mold, toxic metals, glyphosate, or other infections such as viral infections, parasitic infections. All of these things will dysregulate the immune system, and it can cause something like a stealth pathogen like Lyme to come out of hiding. So the other thing that can happen, and then I'm going to get into some of the symptoms here, but the other thing that can happen with this is some people have Lyme disease and they don't manifest the common symptoms, right? Some people, it just looks like a flu, just looks like an acute type of infection. It resolves on its own, and people don't actually manifest anything that would lead to antibiotic use or lead to treatment when they are bitten. These people, we don't really call them post-treatment Lyme disease syndrome because they never were treated, but the symptoms are going to look the same, because what will happen for those people is that the immune system takes care of those active forms. It goes oftentimes into dormancy because the dormant forms have not been treated. And just like with post-Lyme syndrome, then all of a sudden, due to stress, due to infections, due to toxins, due to other types of viral or parasitic infections, we see that then that emergence, that Lyme that was in dormancy, that Borrelia that was in dormancy comes out of dormancy. So this can happen because the body self-resolved that acute situation, or because we see this with post-Lyme treatment, right? So within the context of that, then, the next question is, what are the symptoms? So when we have this reemergence, now we have a widespread inflammatory reaction. So we can see a ton of different inflammatory molecules going, through the roof. We can see certain things like autoimmune markers turn on, autoimmune markers for things that are maybe more like strange autoimmune markers that are not commonly tested for. So maybe it's cardiolipin antibodies, for example, right? So there can be all these different antibody changes that can happen due to this in the chronic scenario. So this might look more now like chronic fatigue. It might look like fibromyalgia. It might look like headaches. It might look like migraines. It might look like dizziness, vertigo, POT. It might look like anxiety, insomnia, depression. It might look like the insane brain fog where you can't do anything, or it might just be this generalized pain. And so this can happen in post-treatment, or people that were never treated and it just went into remission and now it's coming out of remission. The problem is many times there is not testing that's done at this stage because people are thinking it's not Lyme. Now, we do want to consider testing, and you do want to do something more than the conventional testing. The conventional testing, the first line of conventional testing, one study showed that it was a 67% chance of a false negative. So it's not very good testing. So we do want to get more proper testing. I use a company called Vibrant Wellness. There's other companies out there, such as through IGenics. We do want to get proper testing done. Now, as I mentioned, I told you I have a free resource to help you. If you go to getwellquiz.com, you're going to find a free quiz. In that quiz, it's going to take your symptoms, and it's going to tell you, based upon your symptoms, is it more likely a Lyme disease cause? Is it more likely a co-infection? Is it more likely a toxin or a thyroid or something else? So it's a quiz for you to take to get your top few root causes that are probably most related to your symptoms. Obviously, it's not medical advice. You should always talk to your doctor. The point of the quiz is to say, hey, big picture with what I see in my practice over 15 years of experience with the symptoms you have, it's kind of educational. What are the tests that I would be thinking about for you as the top test to be asking your doctor about? So after you take the quiz, you'll get a follow-up email that shows you, that tells you, hey, these are the things that are some of the top concerns that I have seen, and these are things to ask your doctor about and tests to get taken and all of that. But you do want to make sure that if you're experiencing the symptoms that I am saying, and usually with Lyme, it's multifactorial, it's multisystemic. So if you just have migraines, for example, and that's your only symptom, in my experience, it's very, very unlikely that that is Lyme disease. Anything is always possible. We don't know until we test. Remember, test, not guess. That being said, Lyme tends to be multisystemic. What that means is you're going to have pain in your head, plus you're going to have pain in your knee, plus maybe you have a gut problem, plus maybe you're tired, right? It's going to affect multiple areas of the body because of the large impact on the nervous system and the large inflammatory process. And inflammatory molecules affect our entire body oftentimes when they are released because they get into our circulation. So because of that, it's going to affect so many different areas of the body. Now, we want to remember many people think they have post-Lyme treatment syndrome, and when actually, in the actuality, it doesn't turn out to be that. It is reaction to something like mold, or it's a chronic hidden other type of infection. So remember, there are many things, mold, viruses, parasites, that can also mimic Lyme disease, that can look very, very, very similar. So this is why we do want to run proper testing, because we want to consider if you're having these symptoms, could it be post-Lyme? Possibly. But could it be one of these other things? And this is where testing is really important. I'm also going to give you information below to join my group program. In my group program, you have the ability to ask me questions. So if you want to ask me questions, it's a great way of getting your questions answered. So I'd encourage you to go take my quiz at getwellquiz.com, because that's going to give you some insights, some ideas to take to your doctor. And then if you want to speak with me directly, please join my group program so that you can do that and get your questions answered that way as well. It's a pleasure to serve you as always. Please do like and share my channel so I can help more people. It would be greatly appreciated. And I'll see you next time. Ciao for now.